Did you know that on average, more than 800 million Americans live with some form of undiagnosed kidney or heart disease that leads to their lower quality of life and in some cases death? While a routine checkup at the clinic or doctor's office may help prevent the onset of these comorbidities, the sad truth is that not everyone has equal access to quality health care. That is why we, Perio DX, have developed a point-of-care heart and kidney diagnostic kit to ensure everyone has the opportunity to take their own health into their own hands. With our biomarker detection kit, we hope to provide an inexpensive and rapid alternative to clinical blood draws to assess whether a person may be at risk of renal or heart disease. Overall, the kit is perfect for those who suspect they are at risk of developing heart or kidney disease but can't afford a doctor's visit. But enough talk, let's see how our kit works.
Our kit consists of two components, the diagnostic assay, which focuses specifically on measuring inflammatory biomarkers IL-6 and CRP, and the companion app, which quantifies the color change results. Our detection assay utilizes a sandwich mechanism, which is a strategy for binding the antibodies with the sample. The main materials used in our device are nitrocellulose membrane, multiple absorbent pads, cassette, and the biologics. The nitrocellulose membrane serves as the front line of our device, housing the test site where detection and color change will occur. Within each test site, the capture antibodies are mobilized to the nitrocellulose membrane, ready to capture proteins from the sample. The device is then assembled with the nitrocellulose membrane placed atop the layer of absorbance pads. These two layers become housed in our cassette, which provides pressure and stability to the assay. The sample, eventually the patient's GCF, is introduced to the test strip, allowing it to flow through the device. As it passes through, the antibodies bind to the target biomarkers present in the sample. Color change happens once the protein is sandwiched between the capture antibodies and the gold nanoparticle conjugated detection antibody, emitting a red hue. So once the conjugated solution containing detection antibodies is added, a color change indicates the presence and concentration of the biomarkers, providing rapid and accurate results. These results are then analyzed on the companion app, which we'll talk about next.
All right, now that you know a little more about this device and how it works, let's talk about something a little different. Let's say you just bought this device and after placing the GCF on the strip, you get a color change. It turns red. Now what does this mean? Is it good? Is it bad? Is your life in imminent danger? Don't worry, we got you covered. That's what we built the app for. We called it Perio DX. A little on the nose, isn't it? The app is made with the customer's security and convenience in mind. It's highly directive and intuitive. In simple terms, it's very easy to use. Let me show you. The journey begins with the app's secure login, ensuring that user data remains protected at all times. Firstly, we are going to create a brand new account using the app's functionality. Now that we have your account, let's try to break into our account using an incorrect password. Notice that the app can detect incorrect passwords and give an error. Now we're going to log into the app with the legitimate credentials. Once logged in, users are greeted with clear and concise test instructions, setting the stage for a seamless experience. Now, witness the app's utility as we can scan the device using its intuitive camera functionality. The app's design is not just about looks. It's about delivering accurate and responsive results in real time. The app's GUI is a testament to our team's commitment to user-friendly design, ensuring that the analysis process is both efficient and straightforward. The results are displayed clearly, allowing for easy interpretation and decision-making. We're proud of the companion app's performance, particularly its seamless user experience. Now onto the procedure and validation for the device.
Precision in diagnostics is not just a goal, it's a necessity. For Perio DX 2.0, ensuring this precision begins with rigorous verification and validation. In phase 1 of our device design, our focus was on the mechanical functionality of our device assay. A key objective was optimizing the device to ensure precise fluid management. Our team carefully selected the best absorbent pads to control fluid flow through the device and conducted detailed bleeding and fluid flow tests, which is essential for verifying accurate and consistent sample processing within the device. From there, we transitioned to phase 2, singleplex studies. Here, our primary focus was on achieving a clear, measurable colorimetric change when detecting individual biomarkers. ELISA experiments have validated critical functions of our assay. We confirmed the functionality of our protein biologics and assessed the binding efficiency of our capture antibodies to our target biomarkers for optimal sensitivity and specificity. And by establishing a standard curve through ELISA, we accurately gauged the protein concentrations our device can detect. ensuring reliable biomarker readings for effective disease diagnosis and management. This step is essential as it allows us to fine-tune the assay's sensitivity and ensure that even the slightest color changes can be accurately captured and quantified by the Perio DX companion application. After establishing robust singleplex assays, we advanced to phase 3, focusing on multiplex integration to detect multiple biomarkers simultaneously from a single sample on a single device. We added a negative control to compare results directly and reduce variability, creating a reliable and precise diagnostic device. At the same time, the Perio DX companion application is validated for speed, ensuring results in under 30 seconds and security to protect our end-user data. We tested across different device platforms and generations for optimal compatibility and responsiveness. User feedback also informs ongoing refinements, focusing on enhancing the clarity of our manual and the usability of our app based on actual end-user experiences. In conclusion, verified through rigorous testing, Perio DX 2.0 system embodies the integration of cutting-edge science and patient-centered design. We satisfied all of our system requirements and met the needs outlined by our sponsor. It is not just a step forward in medical technology, it is a leap towards personalized preventative healthcare.
The importance of this project cannot be understated with the ease with which it will allow people to quickly test their risk for chronic kidney disease and cardiovascular disease, having the potential to save hundreds of thousands of lives. Currently, nothing this accessible exists on the market, and with the success of our device, the goal of an at-home test moves one step closer to reality. As this project demonstrates a clear proof of concept of the diagnostic in a multiplex design, the next step should be to focus on the collection of GCF. Going forward, the scope of this project should include the addition of more inflammatory proteins, such as MMP8, MMP9, IL-1 beta, and cystatin. The beauty of this device is that anything that causes inflammation, such as autoimmune diseases or gastrointestinal disorders associated with these biomarkers, can be tested. We aren't just limited to kidney and heart disease. The prospect of users being able to store their test history with the electronic health record is also something that would be beneficial with future iterations of the software, adding better connections between patients and healthcare providers.
The device that we have developed and shown here will be life-changing to individuals with chronic kidney or heart diseases that are not receiving the care they need. Our device, capable of diagnosing these diseases using the inflammatory biomarkers associated and the companion app to help better understand risk and severity, will be able to help thousands of patients currently undiagnosed. Once our device is on the market, our patients will have the ability to take a fast, cost-effective, and accurate test in the comfort of their own home. This will save the patient time, money, and worry, decreasing the heavy burden on our healthcare providers and system. With the design, even further research, as we had mentioned, can be done to help even more patients reach a healthy lifestyle, free from worry. With this, I would like to thank our sponsor, Dr. Marvin Slepian with the ICABI, NIH, and the University of Arizona, as well as our amazing mentor, Walter McDonald, and help from our collaborating lab, Dr. Yin Chens. Thank you. We are Perio DX, helping you open doors to your health.